Hey guys, Pastor Tim here with Our Watch, and we've got some updates for you. This is breaking news. This is stuff going on right here in Riverside County, all across the state of California. I have my guest here with me, Megan Hill, who is a registered nurse, and she's been a registered nurse for several years now. And we want to talk to you about what's going on, just like I said, Riverside County, because it's the county I live in. But if you live in the state of California, and even if you live in the nation of America, this is going to affect you. So just yesterday, there was an article in the Press Enterprise came out, said Riverside County coronavirus hospitalizations set a record. 257 cases were added. And it says that these confirmed cases of coronavirus on Wednesday, June 17th, as the number of hospitalizations from the virus set a new record according to the county public health website. And I'm here to let you know, of course, they're setting new records because I've said this before, and I'll just repeat it. We're importing patients, and that's exactly what's going on. And so we've got Megan here to talk about what's going on as a registered nurse working here in Riverside County.
Yes.
What do you think about this sudden climb in numbers, and how is this happening here in the state of California?
We're transporting them. We are transporting them from the Imperial Valley. According to my patients, they are coming over from Mexico because they're not getting treated in Mexico. And they're coming over to this Mexicali, Calexico, Imperial Valley, and El Centro, that whole area. And there's a small hospital in El Centro, and they have become overrun, according to my patient. And they are flying helicopters every hour. Bam, 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 constantly flying them. And we were the first ones to receive them, as far as I'm aware. Riverside County was. All of our small local hospitals received patients. And according to him, they agree that they will fly you, but they will not fly you back. They will not return them via the life flight that they came on.
So you're working in a COVID unit.
Yes.
And next thing you know, every hour, bam, 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 they're just flying them into you.
Well, not on my shift. I think a lot of it happens on night shift. My patient got there at 2 o'clock in the morning, and I received him that next morning on day shift. So I think a lot of it's happening at night. I haven't received anything during the day, but it's definitely happening. I mean, I know a lot of people are like, oh, they're, from America or they're American citizens. It doesn't matter. You don't move COVID positive patients during a pandemic.
Okay.
That's just not something that should be done.
So they're flying them in. Are these Americans that are coming in?
I don't know. I don't ask. That's not my business. My business is to treat. What I do know is a lot of them are Spanish speaking only. What I do know is that what my patient said is a lot of them are coming over the border and going to this hospital, and we're flying them from this hospital. So from what I'm seeing, I don't know where they're from. I know that they're Hispanic, Spanish speaking only. That's what I'm experiencing.
Okay. So they're coming from Mexico, though.
Yes,
Yeah.
Yes, they are. They're crossing the border into this hospital, and they're flying them from this hospital.
Okay. So they're getting life flighted in. And we're talking about cases in Riverside County and whether or not we're seeing a spike, because this is what we're being told is that there are new records. We're getting a whole bunch more. Is this because we're flying them in? Like these people that were crossing the border, getting into our healthcare system and coming now life flight to Riverside County, is that affecting our numbers in Riverside County?
Absolutely. Our county is counting these people as patients, as Riverside County positives, new positives. They are not. They have tested positive already in the county of San Diego. They're flying them over to the county of Riverside. So if you were going to do that, why is Riverside the one taking on the counts, right? I'm pretty sure El Centro is in San Diego County. So why is Riverside County taking those counts? We are, in fact, taking those counts. The COVID deaths are our deaths. The new positives are our positives. And I just want to make clear that they're being life flighted, but they're stable. These are not critically ill. We have to rush to save these patients. This is a humanitarian effort. How dare you be upset that you're taking these patients? They're walkie-talkies. They're alert-oriented. They're ambulating by themselves. They're on room air most of the time, which means they're not even requiring extra oxygen. So it's not something that is like this emergent, these patients need to be life flighted.
Okay, so then why are we life flighting them?
Well, it's a lot faster than driving. According to my
Yeah.
patient, he stated that you fly 2 hours, an hour there, an hour back, and you drive 2. So it's either the difference between 2 hours and 4 hours. And
Okay.
they can get them here faster.
Okay, so that's the difference then, is just the time. I'm just assuming, and people watching online right now can probably just in their own mind imagine that it cost a whole lot more
Yes.
to fly them here than it would to drive them there.
There's also
know.
incentives being given to these life flight agencies to fly COVID positive patients.
Okay.
So they're
Well,
lining up.
So, well, yeah, of course, and here's why. If you haven't been following up on what I've been doing, I did put out recently that I have an email from a whole list of CEOs of California hospital associations, the Southern California Hospital Association, Central California Hospital Association, Northern Cal Hospital Association. All these CEOs of these major hospital associations are putting the call out that the state wants to put these people across our state and that the state is going to pay for it. And it's funny that people say, well, the state's going to pay for it, because who's the state?
We are.
We are.
Yes.
So I'm going to pay for it. You, if you're watching and you're a citizen of California, you're paying for it. So
Yes.
instead of driving them, we're putting them in a life flight and we're flying them,
Right.
which I'm being told costs anywhere from $30,000 to $100,000
Absolutely.
per patient.
Absolutely.
$30,000 to $100,000 of our money
Yes.
that should, first of all, should not be spent, because these are people that are sick, so they shouldn't be moved anyways,
No,
right?
no, it is unheard of. It is unheard of. You do not move, especially during a pandemic. Can you imagine? They're telling us to stay at home. We're healthy, but they're saying stay at home. But you're going to move a COVID positive patient during a pandemic? You quarantine the sick, you quarantine the ill, and you keep them home. You keep them located in a central area so that you can stop the spread of COVID or whatever disease is going on. When Ebola was going on, we didn't fly Ebola patients out all over the country. And when New York was overwhelmed, we did not, they didn't disperse all of their COVID positive patients. You send people there. You send nurses there. You send Navy corpsmen there. You send help there. You don't disperse COVID positive patients during a pandemic. You don't transport them anywhere. You keep them located so that you know who they, are in contact with and who you need to watch for. And you want to keep it as isolated as possible. It was shocking when I heard this was happening. It's like, why? I don't care where they come from. First of all, let me make that clear. You could be coming from Kentucky. You should stay in Kentucky. Wherever you're sick from, you stay there. You don't move COVID positive patients, especially during a pandemic.
Right. Well, the question then is, well, how do they get care? I mean, so if you're just now tuning in line, we're talking right now with Megan Hill. She's a registered nurse. She's very well aware of the fact that our state is using these patients as pawn in a big political game. This is just disgusting. And so just trying to catch you up if you're just now tuning in. Now, one of the things that we have to be aware of is with them transporting these patients, that what they're saying is that the hospitals there are overwhelmed. And I understand that. Of course,
Totally.
if they're overwhelmed, people need care.
Absolutely.
I've reached out to Samaritan's Purse to try to get some help there at the border, try to
Right.
get people there and get them the help they need, because they
Absolutely.
need help.
But you keep them there.
You keep them there.
You keep them there.
And that's the best, most safe way to handle
Yep.
this. Now, the question then, and I would love it if Gavin Newsom could answer this for us, is what about these smaller hospitals throughout our state? Are they shipping their patients to other places? And I think the answer to that would be, well, no, we're not, because those smaller hospitals aren't being overwhelmed there in those parts of the state. Well, if they're not being overwhelmed, why is it that they're being overwhelmed down in our southern border? The
Right.
fact is, we've been told that our border is closed, but the fact is it's not.
It is
We've got
not.
70,000 people crossing the border still today.
Yes.
Every single day, 70,000 people is a lot of people, especially when I'm being told by doctors at the border that we have a new strain of coronavirus coming across our border. I'm being told that it is the death numbers down there in Mexicali are double the amount that we're having in on our entire state. In
Right.
one day,
Right.
double the amount in our entire state. So why are we allowing that flow across the border? Why are we flying them all over the state? And here's another thing to ask. And I know that many people are tuning in right now, and they've seen this today. Californians, this is according to our governor, Californians must wear face masks in public under coronavirus order issued by Gavin Newsom. And what he's saying is, listen, the numbers are going up. You guys aren't taking this seriously.
He's created this.
Well, this is cultural Marxism. That's what cultural Marxism does. It creates the problem. It is the
Government comes in
solution,
and
and then
solves it.
everybody
Yep.
praises
Absolutely.
the person who created the problem in the first
And
place.
that's what he's
well,
doing.
I can tell you this: I'm not going to be praising Gavin Newsom anytime soon.
Absolutely not.
But here's where we're at. I want an answer as to why is it that he's made an agreement that the state will pay for us to fly people all over our state, put them into our hospitals, bump up our numbers, and then keep us all on lockdown longer.
And we're not sending them back.
And we're not sending them
We're
back.
not sending
So
them back.
explain that.
They are told when they fly that they will be flown here and they will not be flown back. So their way home is up to them. Oftentimes we're hearing, oh, I have an aunt in the area, or I have a cousin here or an uncle here that can pick me up. Is that the case? I don't know. Are they truly related? I don't know. Is this something more conspiracy theory? I don't know. What I do know is it's very convenient that they're being flown here and left here. They're not, transport back is not happening. When you transfer a patient from one hospital to another, case management sets up both, there and back. So why is case management, because they're the ones, case manager is the one who would plan all of this. Why are they not saying, well, we need to make sure that we get them back home?
Right.
Where is their home? Where are they from? We
Right.
have to have, and we can't even send a person who's homeless home without an address. You have to have an address. So how are they getting home? Where are they going? Are they staying here in California? Are they staying, we've flown some up north. Are they staying up north?
Yeah, well, I'm talking to doctors down on the border, and I'm hearing stories. Like there was a story of a 75-year-old man. He had no clue where they were going to fly him to.
No, they don't.
He had no clue. And then he
My
says,
patients
okay,
are
well, where?
so scared.
They're scared.
They are so scared. They have family, they have daughters and aunts and sisters that they provide for, and they are terrified on how they're going to get back.
Yeah.
They didn't have a choice whether to be flown here or not.
Yeah.
They were told this is where you're going.
Yeah.
And this is where they go, and
Yeah,
they don't
this-
know how they're getting
The
back.
75-year-old man says, well, where, you're sending me where? Oh, well, where is that? And how's my family going to know?
That's
and,
right.
And then what happens to this guy? Something happens and nobody in his family even knows where he is.
Absolutely right.
So you talk about a case manager. Case manager does what?
They set up the behind the scenes stuff. So I'm a bedside nurse. I pretty much handle everything at the bedside. Case manager is going to do transporting to and from, home health, set up whatever the patient needs after discharge.
Okay, so the case manager, I'm assuming they put together some sort of paperwork. They're sending that paperwork with the patient.
These patients are not coming with any charts. These patients are
You've gotta
coming.
be kidding me.
There are no charts. There are no allergies listed. When we look up the H&P, which is the first thing that a nurse is going to do when they get a patient, they're going to look up the H&P. What is the past history? What are they allergic to? Who brought them here? How did they get here? Emergency room nurses know, BIBA, brought in by ambulance, right? Patient brought in by ambulance, 53-year-old, allergic to whatever, came in with family, arrived, patient walked in. All of this stuff is important in treating the patient. It might sound very funny to people who are not nurses, but if I know a patient walked in, okay, did they walk in and now they're septic, so now they compensated so much to be able to walk? Like, there's so many things that go into when you read an H&P. These patients have none. It'll say Hispanic male 55. No medical history. And you're like, okay, any allergies? Nothing. And these H&Ps, they go over it. Family history, cancer history. They have all of these things. Mother's diabetic, Nothing. They're coming in with nothing. Nothing.
Okay, so I cannot comprehend the amount of incompetency that's been going on here.
You and me both.
So you're tasked with taking care of patients they bring in the door. And you as a nurse, you don't care where they're from.
I don't care where they're from.
You don't care where they're from, what their nationality is.
Nope.
You just want to help them.
Absolutely.
But how are you supposed to help them if we're shipping them into your hospital and they don't tell you
Anything about them.
anything about this person?
Mm-hmm.
If you're tuning in online, you got to hear this. You got to be thinking this is an absolute joke. I cannot believe
It is happening.
that this is what's going on in our state. This is total mismanagement.
Absolutely. And as a nurse, it's terrifying when you don't know a patient's medical history, or especially their allergies. What are you allergic to? I don't know. Okay, so I'm going to give you this medication, and I'm going to hope that you don't react, right? It just adds a whole other list of problems to critically think throughout your day. Have they ever been given this before? You don't know. Have you ever done this before? You don't know. So you try and communicate, and you try and ask, and you try and talk. And there was a huge issue when this first started. This is not new. This has been going on for about a month now. And when this first started, translation was an issue because we didn't have enough translator phones for the patients that they had brought in. And nobody wants to go into a COVID positive room. They don't want to. They're terrified. Even now, people still treat the COVID nurses like they're lepers. Like, what do you have? What are you bringing to me? I don't want to go in there. It's a fight to get anybody to help you in those rooms. And we were realizing that unless you yourself spoke Spanish, it was such an issue to ask, do you have past medical history? Are you allergic to this? There was not enough translator phones to even get into those rooms, because once they're in that room, they have to stay in that room now and for the entire stay until they are completely terminal cleaned, which takes like an hour and a half. So we were running into a lot of translation issues at the beginning. I think now we've been able to overcome that a little more, but it was a big issue, and so it was scary. How can I, as a nurse, correctly treat this patient that I know nothing about besides the fact that they have this illness? And yes, I will follow the doctor's orders and do all of that, but critically thinking, you're always like, well, I wonder if this is going to be the one that tips them over, or do they have something else that's a problem, or do they have diabetes, or need to be checking their blood sugar? I don't know. And I can't get a communication phone, a translator phone in there to really find out. And normally, I think a lot of healthcare workers, who don't speak Spanish, they got their Spanglish down. Like, I got my medical Spanglish down, and I can pretty much, talk my white girl Spanglish, and they know enough to communicate back, and I understand enough. But at the beginning, they didn't understand a word of what I was saying, and I didn't understand them. It was like, oh, I've got nothing in the bag on this.
Yeah.
Yeah, that's a real concern.
Yeah,
it's a real patient
absolutely.
safety
How
issue.
are you supposed to take care of them? Okay, so we're in this time right now where we're being told numbers are being spiked, and we know for a fact they're being spiked because we're importing patients.
Absolutely.
So that's one thing. We're in a time right now where Gavin Newsom says, okay, you're not listening to me, numbers are spiking, so I'm going to double down on my order. You all have to wear a mask, which we all know does nothing.
They do absolutely nothing. Nothing, unless you are fit tested, which means you have gone to a company and there's different types of N95s. They put that on, they put this plastic thing over your head and they spray, and they do a taste test and a smell test. If you have been fit tested for that specific N95, you know that will work for you. Unless you have been fit tested, it doesn't matter what you wear. It does absolutely nothing. It does nothing. The virus is smaller than tuberculosis, which means the cloth that you have on, it swims through. It does nothing. I don't understand why anyone thinks that a mask does anything. It does nothing. Unless you're sick, and you feel like you should wear one, absolutely, then you wear your surgical mask, which are like the bluish ones, and that's wonderful. But in order to prevent me from getting it, I would need to wear an N95, and unless you're fit tested, your mask is doing nothing.
Okay.
What it's doing is socially conditioning you to be told what to do.
Right, yeah. I mean, people that have a brain and they're using it right now can see exactly what's going on. Mm-hmm. This is an attempt to continue to control the environment, to control us.
There's no science that states masks do anything.
Everything I'm reading is telling me quite the opposite.
Absolutely.
This is doing nothing for us, and yet the governor's doubling down, and his mechanism of doubling down on this is telling us you have to wear masks is an increase in numbers, and yet the way he's getting an increase in numbers is he has agreed to take our money and pay to fly them all over our state and spike our numbers everywhere. This is what's happening.
Yes, it is.
Okay, so at the very beginning, when I first started hearing about this, I started talking with you, and I put you in contact. We started like a...
Yes, we did.
We got this rolling.
We did.
And you got a phone call today, and if you're just tuning in, this is Megan Hill. She is a registered nurse, works here in Riverside County, and you're going to have to go back and watch this from the beginning, but she's exposing the truth about what's going on here in our state. So you got a phone call from the Department of Homeland Security today.
I did.
Tell us about that. So what did What did they ask you?
They wanted to know what was going on. They've been hearing whispers and rumors, and it came down to tell me what you know. So I started from a month and a half ago at this point, I'm not even exactly sure, quite some time ago, and I just told them everything that I know, everything that I've seen, everything that I've witnessed, everything that I've been told directly from my patients, from what I've experienced, from what I'm being told from other people. And he said that there is a specific group that handles Mexican relations and that he's going to be contacting them, that this is not okay and they should not be moving COVID positive patients across the border.
Okay. So he's going to let somebody know. What do you think they're going to do about it?
I don't know. I know right now they are overwhelmed with these riots and the looting and the defunding of police and
I'm sorry, you know this how? Because he told you this?
yes.
Okay. All right.
He said that they are overwhelmed right
Okay.
now. That this is serious and he will get it addressed. But they're insanely overwhelmed, and I can't help but think, wow, how convenient. How convenient that you're overwhelmed right now during all of this stuff, and underneath back door, he's shipping in COVID positive patients, right? Underneath your nose, because these are pressing. You need to deal with the defunding of the police and the riots and keeping everybody safe and all of that. Absolutely. That is national security.
Yeah.
And
Sure.
but so is this.
So is this, yeah.
And they need to take it, and he said that he will make the appropriate people aware of what's going on.
I'm sure he wants to help.
He was not happy with what I told him.
Oh,
at
I'm
all.
sure. I'm sure. But I'm sure there's also a thought in his mind that, hey, listen, we want to do our job. We want to do it well, but your governor's making this difficult.
Absolutely. I think that anyone who knows what's going on and who isn't afraid of this, I'm not afraid of COVID. Let me say that. Let me make that very clear. I am not afraid of COVID. I am afraid of what COVID's creating. I am afraid of the ugliness, the distance, the antisocial, the communism, all of this stuff. That's what scares me. This virus, I've seen so many people recover from this virus just fine. Like, some of these people don't even need hospitalization. They really could have just gone home. If these patients who were flown to us, if they walked into our hospital, we would have said, go home and quarantine. Good luck. There's nothing we can do for you. If you're not even on oxygen, there's nothing we can do for you. Go home, rest, wait your 7 to 10 days. If it gets worse, come back, right? Like, that's what we tell anybody. I'm not afraid of COVID. What is happening is not okay.
Yeah.
People should really wake up and be aware of what our governor is doing, and he does not stand for the people. He does not stand for the people.
Well, not when he's doing this to us.
No.
I'm not happy about him coming out with another wear a mask order, especially when
No.
I know that it does nothing.
In fact, it's really bad for your immune system, right? God created our immune system. You need to touch a little germ here and a little germ there, and your body will create an antibody, and it builds your immune system. These are words that we say, right? Build your immune system, support your immune system. You have a battlefield of amazing properties in your body that will fight disease. They will fight viruses. They have already identified a piece of this virus. They're like, oh, okay, we're ready. So when it shows up again, they shut it down and they shut it down. And when you take off all the germs from your hands, take off all the germs that you taste and touch and feel and touch your face and all of those things, your body's no longer building an immune system. So when you go out, you're going to get sick. 100% it's going to knock you on your bum.
Yeah.
That's just the way our immune system is designed.
So, Department of Homeland Security is aware.
They are aware. and
They
are
want to
gonna be
do
working on
something.
it.
Gavin Newsom's making it difficult for them to do their job. There's so many different things attacking our nation right now. We have an attack on our nation. If we're
Absolutely.
not aware, if people aren't aware, you're watching this right now, be very well aware right now, there is an attack on our nation. It's coming
Absolutely.
from many different directions.
Yes.
It's a multifaceted attack.
Absolutely.
And people need to answer to this. Gavin Newsom needs to answer to this. Why is it that he agreed to take our tax dollars, ship people all over the place, allowing numbers to spike up, and then tell us all we all have to wear masks for even longer now? Gavin Newsom needs to answer to this. I want to ask you another question. You quit
I did.
your job,
I quit my job.
something that you worked hard at getting and
Yes.
studied for a long time, and
Yes.
you quit. Why did you quit?
So when I started this, It was scary. You were hearing like, you're going to sacrifice yourself. You're going to take care of these patients, and you better hope and pray to God that you don't get this, right? Because that'll be the end of it. And this is how you go out. And so you go into this and you're like, you know what? God has called me to be a nurse, and I'm going to do what I'm meant to do, and I'm going to take care of my community, right? Like, this is something I'm passionate about. I love being a nurse in my community. I know these people. I see my patients out and about, and I'm like, oh my goodness, you're doing amazing. Like, I'm so glad to see you. I love taking care of my community. And I saw us start to successfully extubate and getting better, and these patients are recovering, and you're like, oh, this is amazing. Like, we're not New York. We're making changes. People are recovering so quickly, right? We're giving them all these medications and upping their vitamins. And then you see the numbers go down to 1 or 2 patients. And we just flexed between 1 to 3 patients for quite a while, a long time, maybe about a month or 2. And then all of a sudden, bam, more patients, bam, more patients, bam, more patients. And they're not from my community. Where are they coming from? Oh, they're being flown in? Why are they being flown in? And I realized quite quickly that I was a pawn in a very dirty political game, and I would not stand for it. So I quit. I quit my job.
It's a shame that it had to come to that you recognize that you're a pawn in this, what you call a very
Absolutely.
dirty political game. And
Yes.
it is. This is a political game.
Absolutely.
Using people as pawns, the poor Mexican people that deserve help.
They're terrified.
They're terrified, and
They
they're
don't
being
want
ripped
to
away
be
from their
here.
family.
They don't want to be flown and shipped. And I mean, could you imagine being in a place that you didn't know, not speaking the language at all, and you're just being told that this is what you're doing? That's wrong. And I could not stop it. I went through the chain of command, and I have done every single thing that I can because I care for my patients. And what's happening to them is not okay, and I cannot have my hand in that. I cannot. I won't. And I didn't. I don't.
Well, I'm sorry that you're going through this. I'm sorry that, and I know this doesn't just affect you. You've got a whole family.
Absolutely.
And it affects your whole family. But I do appreciate you doing what God's called you to do in the
you.
sense of exposing what's going on.
Absolutely.
God tells us first of all, if you're watching this, you're a Christian. God calls you to be 2 things: salt and light.
Absolutely.
And salt preserves the community that you live in, like you talked about,
Absolutely.
the community. Not only does it preserve the community, but it exposes the wickedness that's going on in the darkness. So that's what you've done. So thank you so much.
Thank you for having me. I
appreciate
appreciate
you revealing the truth of what's going on. If you are
Absolutely.
tuning in online, thank you for checking this out. And I just pray that you will share this video out before YouTube takes it down, because you know they're going to try. Thank you.